Hi, I'm Kelly from North Shore Eye Care. Today I am speaking with Dr. David Immanuel. He's one of our partners at North Shore Eye Care and a corneal specialist who performs LASIK and cataract surgeries. I understand you speak some Spanish and Indonesian.
Mm-hmm.
You were telling me you were born in
I was
Indonesia?
born in Indonesia. I came
Okay.
here when I was 8 years old.
Okay. In your free time, you competitively fly radio-controlled gliders?
Yes, I
Okay.
do. Yes.
Okay. Where do you do that?
I fly in Woodbury. I belong to a club called LISF, and we compete. Sometimes I go to different states to compete.
That's cool. And windsurf also is
Yep.
another one of your hobbies?
Mm-hmm.
Okay. You have an 11-year-old daughter?
I do. Yep. Leia.
Okay. And I understand you're an MD and have a PhD. And you've been practicing medicine for over 11 years?
Yep, that's correct.
Okay. Why is it that you decided to become an ophthalmologist? Why did you go into this?
Oh, good question. I actually didn't decide to become an ophthalmologist until pretty late in medical school. I knew I wanted to use my hands. I knew I wanted to go into a surgical subspecialty. But ophthalmology attracted me because I think vision is something that we take for granted, and we don't realize how important vision is until we lose it. And it's really nice to have the opportunity to restore vision, and patients are very appreciative, and the results are also very tangible. And to make a patient go from not being to see anything at all, being practically blind, to being able to see 20/20 vision, often without glasses, feels really rewarding.
Right, very gratifying. Do you recall much from your first surgical case that you did? Anything stand out?
Um, yeah, obviously the first time you do surgery on your own, solo is very nerve-wracking. And I had the first time I actually did surgery solo wasn't planned. I was at the VA, and we had a cataract. We were doing cataract surgery, and my advisor was supervising the surgery. He's a really tall guy, and I remember that day the chair he was sitting on a broken chair, and he couldn't adjust his chair. So he was, being the tall guy that he is, he had to really squat down to look into the microscope. And I was in the middle of the case, and it was a fairly difficult case. And I wasn't sure at some point, and I turned around to ask him a question, and he actually passed out.
Oh, no.
He dropped to the floor, and so I had to do the rest of the surgery on my own. So it wasn't by choice.
Talk about diving right in.
Yeah, exactly. So the case went fine, but one thing I learned is that always expect the unexpected when you do surgery, and don't panic.
Okay, good. That's good. Lucky for your patient that you were able to pull through and get it done. So if you weren't a doctor and practicing medicine, what do you think you would be doing?
I think I'd probably be a pilot.
Okay.
I'd like to fly.
All right. That's a good choice.
Mm-hmm.
And what is it that you find most rewarding? What do you like most about your profession, what you do?
Well, Kelly, I like the fact that the ophthalmology is great because there's so many advanced tools that we use, and like excimer laser that we used for LASIK surgery, the femto laser that we use for both LASIK, and now we use the same technology to perform laser cataract surgery. It makes surgery a lot safer, very precise, and a lot more gentle. We have advanced diagnostic testing equipment that allow us to diagnose diseases earlier, like glaucoma, for example. It's nice to be able to use this technology to help our patients see better, and to do surgery better. The results are much better with cataract surgery and LASIK than it used to be. There are special lenses that we can use to decrease our patients' dependency on glasses. So not only can we cure their disease, their cataract, but the patients end their surgery not needing glasses anymore, and that's very gratifying. And they're very appreciative. They're very happy after their surgery that not only can they see better, but they don't need glasses anymore.
Right. Technology has definitely come a long way. Patients have a lot more options.
Right, right.
It's great.
Right, and for the younger patients
Mm-hmm.
who don't like to wear glasses, we offer them the opportunity for spectacle-free vision with LASIK. And for older patients who have cataracts, we can not only remove the cataracts, but we can put in special implants that allow them to see clearly, and we can cure their astigmatism, we can cure their presbyopia so they don't need reading glasses, and they can function virtually spectacle-free.
Right. Okay, great. Thank you. To schedule an appointment with Dr. Immanuel, you can contact our main office by calling 631-265-8780, and they will set up an appointment for you in our Hempstead office. Thanks so much for taking the time to talk to me. I appreciate it.
Thank you, Ken.
Thanks.